an orientation to management of lines and tubes in the acute care setting. So what we're going to be doing is we're going through a couple of small cases here and demonstrating some of the techniques that we're going to talk about, and basically all in all just talking about what we can do to avoid mistakes when we're first entering our rotations or jobs in the acute care setting. So right now we've got a patient supine in bed, and we want to go through our checklist of what to make sure we have in order before mobilizing. So the first thing we want to do is visualize every line and tube. So here we have oxygen running up to the wall. We've got an IV coming from a pull here. So we want to see that that's going, you can raise your arm up for me, to her left arm. And then we also see over here, we've got a Foley catheter running up there, and we want to make sure that we know where each of those is running before we move so that we don't get anything crossed up. Okay, so another thing to keep in mind before moving is their patient going to have a bed alarm on? And most patients will, so you want to make sure you turn that off before moving or getting up, because often you're going to sit on up, the bed alarm's going to go off, and you're going to then have to manage turning it off while the patient is also up, which is not something you want to do. So you would have to get the patient back down again and then turn it off. So that's one thing to look at. And yeah, the other thing is just look at where things might get tangled up in our movement. So think about what is our plan before moving. Right now our plan is to do a log roll and then push up into sitting, and then do a sit, stand, pivot, transfer into the chair here. So with those things in mind, we want to make sure that nothing is going to get tangled on things like the bed rails, arms, feet, or anything like that. Okay, so now we're going to perform our supine to sit transfer. So, hey Mackenzie, are you ready to try and sit up at the edge of bed?
Sure.
Okay, is it okay if I remove your blanket?
Yeah.
Alright, so this is really important because we want to make sure that we're visualizing all of the lines and tubes before mobilizing. So, upon our visualization, we're noticing two things. We have the Foley catheter here that is crossed under her leg and might cause us some issues. So we're going to try and get that out of the way and get this catheter in a location that it's not going to cross under or between her legs, basically, and cause any type of tripping hazard or anything that's going to snag, hold us up, pull any lines out. So can you try and lift this leg up as much as you can? Good. And then we're going to move this right over here. And so the other thing I notice when I'm visualizing is that we don't have enough slack on the oxygen tubing because it's currently pinched under her shoulder. And we want to make sure that we have enough slack to move, as well as make sure that all our lines are in the correct orientation, that we're not going to cross anything up. So can you lift this, turn a little bit towards me and lift the shoulder up? Good, okay. So now we have enough slack there to sit up, and we don't think that the IV and the Foley catheter are going to cause us any troubles. So we're okay to start our mobility. Can you bend this knee up for me as much as you can? Good. And then what we're going to do is we're going to reach over with this arm and roll towards me. And then I'm going to help you out as you need. We're going to bring these legs off and push up from here, okay? Great job. Okay. So now that we've done a little bit of mobility, we want to reset and recheck all of our lines and tubes to make sure that everything is where it should be, and that in our next mobility, which is going to be a stand pivot transfer to this wheelchair right here, we want to make sure that we run through our checklist again and that nothing is going to be a problem. So in order to do this most effectively, there's a couple of things to keep in mind. And the first one is going to be, where is your pivot point for the transfer? What that means is basically where the lines and tubes are heading before moving. So for example, one thing we really like to do is keep all the lines and tubes and the pivot point exactly in front of the patient. What this does is allow for the patient to either sit in either direction and rotate either way. It just gives a lot of leeway. So that's one option. The other option that's really helpful is thinking about putting the pivot point, or the way that we're moving, towards the location that the patient's face is turning to. So if they're going to be turning this way to do a sit here, we want the lines and tubes this way so that we're turning into them. You always want to turn your face towards the lines and tubes, not away, because that could create some issues with pulling them or crossing your legs, things we want to avoid. So for this transfer, we're going to use the pivot point out in front, like so. We want to make sure that she's got enough slack in the wires to maneuver. We also want to make sure that the oxygen here still has enough slack to reach the location. So what we're going to do is we're going to bring this wheelchair a little bit closer. We're going to make sure we got those brakes on. We're going to get our safety gate belt on, and then we're going to get moving. How does that sound?
Sounds okay.
Okay. One more try. And there you go.
And I lost my ID.
That's okay. Okay. So, a good thing to keep in mind is what happened right just there is I'm setting my patient up for a stand pivot transfer, and I've caught some lines in the gait belt. Just pause, reset, always take your time, communicate with the patient before moving, and make sure that everything is free. And then we're going to do a double check beforehand. Make sure that that's still connected and flowing as we want. Make sure this is still connected. There's no pinches. And make sure the oxygen is still connected. Good. And so from there, we're now going to get up and perform our mobility, making sure that when we stand, that there's not so much slack in these lines and tubes that it's going to drag on the floor and create a tripping hazard. So if you feel like that's going to happen, something you can do is hold it up along with this. And then if you do that with both of these guys. Good. And then are you ready to try and stand up? We're going to turn towards this shoulder and take a seat in that chair.
Yep.
Okay, let's do it. So you're going to push up from the bed and just standing. Good. And we're going to pause right here. How are you feeling?
Okay.
Okay. Again, you just changed position a little bit, so it's good to keep an eye on where everything is. Right now, the oxygen has enough slack, and we're going to have our pivot point right in front of us. So I feel comfortable that we can turn, so I'm going to have you turn towards me. And now sit back nice and easy. You can reach back for that chair. There we go. Good. Okay, so the next thing we want to do, now that we're in the chair, we want to work on some ambulation with this patient, right? So let's say to add some things that we want to teach you guys with assistive devices and some techniques that we've learned, we're going to use a rolling walker for ambulation for this case. And so first thing I want to do is make sure that we can bring this walker in, and it's not going to tangle around any of the wires. And when we get up, that basically that those legs or the wheels of it aren't going to run into anything, create more tripping hazards. So one thing you can do with this Foley catheter here is we're going to bring this in and clip it here on the walker, and then bring the walker in. So we want the IV or anything else running up over it so it doesn't get caught in any of the wires. And as you can see down here right now, we have a little bit of a tripping hazard with the Foley catheter. So one thing you can do is you want to make sure you take up kind of some of this slack, and we can clip it in all together, or often these will have kind of ties or other clips that you can use to wrap it around and kind of create something that's going to hold it in place. Make sure that they have enough slack that it's not going to pull out when they move the walker a little bit, but that there's nothing there that's going to trip them. Okay, how's that feel right there? Okay. Okay, so we've got our IV pole running out in front. We got a pivot point out in front of us. This is going to be running out in front and a little bit to the side. Again, think of that as our pivot point. Make sure that we keep that in mind. And then one more thing we got to keep an eye on before getting up and walking is that our oxygen is still connected to the wall, and that's not going to give us a lot of room to walk. So what we're going to do in this case is we're going to bring an oxygen tank in, and we're going to carry that with us. We don't have one right now, but we're going to demonstrate the skill anyways. So you want to make sure that you're coming and not wrapping this around the patient in any way that's going to decrease the range that you have or cause any discomfort. And a couple of things that you can do. One is IV poles will often have an oxygen tank holder on it, so you can put it there. And that's really helpful because it keeps all of the lines and tubes kind of going in the same direction, keeps our pivot point in the same place. So we know where we need to keep things to maneuver as we need. Another thing you can do is, if I was walking with this patient and guarding on this side, keeping the oxygen tank here, making sure it runs behind me so that I can still guard the patient safely and bring the oxygen along. But for this case, we're gonna keep everything here running to the IV. We've got our catheter running here to the walker. That's all set. So I'm gonna get into position.
Where should I push off of?
So what we're gonna do here is you're gonna stand up by pushing off of the armrest.
Okay.
And then once you're in standing, then I want you to come up and grab onto the walker a little bit, okay? All right, so remember we're gonna push off from the armrest.
Right.
And let's rock forward. On the count of 3, we're gonna stand. 1, 2, and 3. All right, and then you can grab onto the walker. Good. Okay, and so before we walk again, we want to check in with the patient, see how they're feeling. How are you feeling?
Good.
Good. No lightheadedness, anything to worry about?
Yep.
All right, so now we want to check in again with our lines and tubes before walking. So communicate clearly with the patient. All right, let's hang out here for just 1 second, okay? And I'm going to make sure that nothing is hooked on the chair, that we still have some slack here. And we do. So we can take some steps forward. Good. And now let's say we want to turn around with this patient. So what we're going to do is we need to take our IV pole and lines and tubes in one direction or the other. So, but what you want to make sure is, just like before, we want to make sure our face is turning towards the lines and tubes. So what I'm going to do is I'm going to cue the patient. I want you to turn towards this shoulder here. And I'm just going to bring this across a little bit. Good. And we're going to head back to the chair, okay? And again, once we turn around, I want you to turn towards this shoulder. As you can see, if she started turning towards this shoulder, what would happen with these lines is she would get crossed up. She might run out of line, she might pull something out, or she's going to make the transfer less successful. So I'm going to have you turn towards this shoulder here. And then before you sit down, I want you to feel for the back of the chair with your legs. And then I want you to reach back for those armrests and take a seat nice and slow. Good. Okay, so now let's say this is where we're going to end our session and the patient wants to stay in the chair. We're going to run through our checklist, but this time it's not pre-mobilization, it's the post-mobilization checklist. So it's thinking about what we need to do to move. We're thinking about what does this patient need to be successful remaining in bed. So first thing we could do is we could take this gate belt off. Good. Next things you want to do is make sure that you have everything the patient needs in reach. Call bell, tray table, pillows, all these things. Is the bed alarm, chair alarm on? Make sure that before you walk out. And then last thing, you want to make sure that all these lines and tubes are set up the way they were. So we don't want to pull this away because our Foley catheter is still set here. So we're going to instead bring this over. We're going to untangle our makeshift holder. And we're going to set this up on the chair here. We can now pull this away, making sure that our lines are clear before moving anything, including the assistive devices. We're going to plug this back into the wall, including our oxygen. And so now, as you're plugging everything back in and hooking the patient up, it's easy to get everything tangled, so making sure that we visualize origin and destination of everything. Okay, so we're then going to run through real quick before we head out, or check in with the patient and head out, is do they have call bell in reach? Is the chair alarm on? Is everything hooked up the way that it started the session or needs to be? If you've unplugged anything like monitors, telemetry, blood pressure, and oxygen are the ones that you see most often. Make sure those are all hooked up again, and then check in with the patient. How are you feeling?
I'm feeling good. It's good to be up in the chair.
Good. Is there anything else I can get you before heading out?
Just a blanket.
Okay. All right, so that is our intro to managing lines and tubes when doing some transfers, getting out of bed to chair, and doing a little bit of walking. Keeping in mind turning towards the lines and tubes so that you don't get crossed up is really important, especially with doing stairs. That's something that's going to come up. We couldn't really demonstrate that here, but when you're walking upstairs, make sure you visualize how much line exists for a patient to walk up. Can we walk up 2 steps and then are we going to turn around? Or are you going to carry everything with you? And if you do, make sure that they're not crossing the legs in front, make sure they're not catching on the railings, and make sure you cue the patient to turn towards the side that you want to make sure that they're not pulling away from the wire.